The main benefits of this way of treating bunions is that the incisions are very small. There's a smaller chance of things like infection or wound healing complications. The pain is a lot less. A bunion, or in fancy medical terms, hallux valgus, is the bump on the inside part of your big toe that can form with time. Over time, that bump can get bigger, and the tip of your big toe can start pointing towards the smaller toes and start deviating out towards the side. For a lot of patients, this doesn't cause a problem and there's no pain associated or no issues. However, when a bunion becomes symptomatic, patients can experience issues such as pain over the bump on the inside of their toe, difficulty putting on shoes, feeling as if the shoes are really squeezing the foot. The shoes can also start rubbing over the area of the bump, which can lead to skin breakdown, irritation, or thickening of the skin or callus formation. Patients generally come to see me once their bunion starts to become symptomatic. So if they start to have pain, irritation of the skin, callus formation in that area, that's generally when patients start to see me. Sometimes a bunion can progress to the point that it's not just a painful issue and it's not just an issue where your skin is getting irritated, but it can really have a big effect on your life. Sometimes a bunion can unfortunately develop to a point where it really causes problems for patients. Sometimes the bunion can become so severe and the symptoms can also become so severe that patients aren't able to do the things they need to do or want to do on a day-to-day basis. This can be because the deformity has progressed to a point where they're not able to wear proper shoes, their gait might become altered, and they may just have a lot of pain that prevents them from engaging in activities that they need to perform. During our first clinic visit together, you can expect me to take some time to listen to what's going on and listen to how long this has been an issue for you. Also, I would do a very thorough examination of your foot and ankle. Some of the things that I check for specifically when it comes to a bunion is to make sure that there's no numbness that's happening. Sometimes as the deformity gets more severe, some numbness can develop on the inside part of your toe. Some other things that I also check are to check about how flexible the bunion is or if I can manually correct it or not. And one other thing that I check for is instability elsewhere in the foot, as sometimes issues elsewhere in the foot can contribute to worsening of a bunion. In general, for imaging for a bunion, I start with x-rays of the foot. This helps me to determine the severity of the bunion. And there are a lot of different features of the foot that can allow me to determine what procedure might be the best for you if we ultimately need to go down the route of surgery. So in general, for treatment of bunions, I like to separate out the treatment strategies into two different categories. The first category being non-surgical treatment, and the second category being surgical treatment. As a rule of thumb, surgery should never be performed for cosmetic reasons alone because surgery unfortunately has its risks. However, if you've reached a point where the bunion has become a really big issue for you in terms of pain and preventing you from doing the things you need to do, we can talk about surgery. But before that, I like to talk about the non-surgical treatment strategies. These can be options such as orthotics, shoe wear modifications, toe spacers, bunion splints, just to name a few. In terms of surgery, one of the options that I'm really excited and passionate about is minimally invasive bunion correction. I had the opportunity to learn from some really good mentors during my fellowship, and it's a procedure that's not too commonly performed, but something I feel very passionate about in terms of it being a game changer. I think it's a truly cutting edge technique that really optimizes your outcomes. So the general concept is that I'm able to perform a bunion correction through incisions that are as small as possible. These involve 3, maybe 4 incisions, each very small, each requiring only a single stitch or suture. And I use this special instrument called a minimally invasive burr. This spins at a low revolution per minute, but has a lot of torque or power to it. So it allows me to work with bone. So in general, what I do is I use this burr to make a cut across the bone and shift it and hold it into place with screws. This is called an osteotomy. This is very similar in concept to the traditional way of correcting a bunion, but it's done through a very small and minimally invasive manner. The main benefits of this way of treating bunions is that the incisions are very small. There's a smaller chance of things like infection or wound healing complications. The pain is a lot less. Patients that have previously had the traditional surgery on one side and have the minimally invasive surgery on the other side say there's a night and day difference in terms of how much less pain there is, how much less pain medications they've needed to use after surgery. Finally, in my mind, the biggest game changer is letting you put weight down on the foot starting the day after surgery in a special shoe. This is pretty awesome in comparison to the more traditional route in which I generally had patients not putting weight down for 6 weeks or even longer after surgery on the foot. After minimally invasive bunion surgery, I let patients start putting weight down on their foot in a special post-op shoe the day after surgery. I have a special dressing in place that remains in place for about 2 weeks after surgery. At your first visit 2 weeks after surgery, I swap that out for a new dressing, and that stays on for an additional 2 weeks. So that's 4 weeks of this special dressing being in place. But during that whole time, I'm allowing you to put weight down on your foot, but I'm asking patients also to try to limit it to the essentials of day-to-day life, not necessarily going for a run or going out and mowing the lawn. At the 6-week mark, I let patients start easing into low-impact activities such as cycling, going for longer walks, yoga, Pilates, swimming. And at the 12-week mark, I let you start easing into full activity, like high-impact activities like running and jumping and sports. One of the main advantages of minimally invasive bunion correction is that I get to get you putting weight down on your foot starting the day after surgery in a special shoe. And this also jumpstarts the rehab process. I think this is pretty amazing because in comparison to the more traditional route where you're not putting weight down on your foot for 6 weeks or even longer, I think it's a huge, huge win for patients to be able to start walking immediately after surgery. Ultimately, the biggest win of minimally invasive bunion correction is that you get back to your life sooner.